Florida, Mr. Stearns, for 2 minutes.
Gentleman is recognized. 2 minutes.
I thank the distinguished chairman. The bottom line, this is the bottom line, the Senate language in the health care bill does not protect VA and Department of Defense health care systems from interference by other federal agencies such as Health and Human Services. We need to have the Boyer-McKeon bill part of this package, or you're going to leave out a whole segment of veterans who are under TriCare, not to mention survivors and dependents who are covered under the CHAMP VA. This is extremely important to American veterans. So I urge you, Democrats who are in the majority, to reconsider Mr. Boyer's simple request to make part of your bill today immediately, as much as possible, to amend it so that we include the Boyer language, which is 4894. It's not a major thing to do here. We can do that. Now, Mr. Skelton here earlier said that he's against the health care bill. He emphatically said he's going to vote no. I understand that. He feels that the Democrat health care bill is not something he can support. He's chairman of the Armed Services Committee. He understands that passage of this rule that we're going to talk about later will deem passage of the entire health care bill in America. But then here we are trying in desperation, because this is a farce, this health care bill, because it strips TRICARE from the military veterans. It hurts survivors and dependents. Now, in a charade here of a farce, they're trying to amend a bill that has never passed. Think of that. This bill that we're going to vote on, the Skelton bill, is amending a bill that has not even passed. So I even question the constitutionality and the procedures here. The health care bill is not going to protect Department of Defense, military people under TRICARE, and veterans. Now, why is this occurring? I think we realize because the Democrats move too quickly and they're penalizing our veterans. And so the chairman of the Armed Services Committee is against it. More importantly, he's here with this bill. And I think all of us should understand, without passage of the Boyer-McKeon bill, which is 4894, the bill has been dropped, to amend the Patient Protection and Affordable Care to ensure appropriate treatment of Department of Veterans Affairs and Department of Defense health programs. This is a simple statement, but it has huge implications. So, Mr. Levin, I urge you to reconsider and to make sure that part of this McKeon bill is the language of the Boyer-McKeon. And again, I would just close by saying that a reason why we're here today is because the bill was put together improperly, and it's just an affront to our veterans, to our military retirees, that they are going to be affected by this health care bill.
Gentleman is recognized for 1 minute.
Mr. Speaker, there's something else that's going on here, too. Okay, so the Skelton bill passes without the Boyer-McKeon. Okay, then the health care bill comes tomorrow. We vote on it tomorrow night, and it passes. But it's still, the veterans will still be without care, because this bill that's passing here has to go to the Senate. The Senate could make some changes, then it's going to come back to the House. So you're going to have a bill, a health care bill out there, standing by itself, that's passed, gone to the President, signed into law, that does not protect veterans on TRICARE. You should be very concerned about that, and I think the American people should be concerned that our veterans who are at 2 wars today are not going to be protected because you're delaying the enforcement of the rigorous understanding of what this bill is about. So just simply passing this today under suspension will not mean the veterans are protected. It still has got to go to the Senate, comes back to the House before it's signed by the President.
Have remaining.